We now have Raman, who's also working with the Governance Hub of Public Health Foundation of India, who's going to present a paper on nurturing nurses in India.
So this is something about governance of caring. And one of the least cared within the health system. So I have all my colleagues around, the instrumental person sitting there, Kaveri, in that. This largely, if you look at the background of the governance reforms for nursing, there is a push. There was a push for nurturing nursing in India ever since Bore Committee, Mudaliar Committee, and NRHM in the recent past brought a kind of focus by financing it, starting to financing it, not financing it properly, but starting to financing the sector. If we look at the existing situation, underproduction, migration, poor education standards, discrimination, harassment, lot of features comes in. Exploitation is added if you look at the private sector. And nurse movements are slowly and steadily, not only nurse organizations or associations. Now we can see from Kerala, from Tamil Nadu, from Delhi and various other places, slowly and steadily, which is called Jasmine Revolution or something. It is coming up. And what Kabir presented about inadequacy, capacities and welfare is very much important in the context of nursing. And universal health coverage, the HLEG recommendations has further advanced the issue, the importance of the issue of nursing in the country by almost 3 times growth of the sector, that includes from ANMs to the staff nurse to the nursing administrators. And unless and until, given the current situation of nursing, the pathetic way the nursing sector has been taken care by the health system as of now, to achieve what is required will be very difficult. This is what is the background of our study. And we proposed this study in 2011. It was about to diagnose operational, ethical and political challenges of nursing governance, taking 4 states as kind of samples, and apply this knowledge to the national canvas. For that, we initiated with, as a precursor, we initiated with a literature review to characterize the state of nursing governance in India and the similar low middle income country settings, and to identify challenges towards effective nursing governance. And this presentation is just covering the Indian situation. We are not covering the broader canvas of the LMIC here. We used to kind of describe the method, we used journal articles, reports, policy documents and briefs, commentaries, and the keywords are listed here. 22 documents from India, overall 55 from the LMIC we use for this study. This is the WHO's conceptual framework for effective nursing services, wherein it starts from policy and planning, education, all pillars, education and training and development, deployment and utilization, regulation, evidence for decisions, leading to equitable distribution, equitable access and quality, largely the quality of health services, not only nursing. From that, we are deriving leadership and regulation, education and development, deployment and utilization, policy making and planning as the theme for this literature review, wherein from leadership we find that, I'm straight away getting into the finding, leadership development is fractured and it is, some of, it's not properly thought through, that is one. Then involvement of nurses in decision making across the health sector is, we use the modest word called debatable, but we can say, because we have to rely on literature, but in actual sense we know what it is. And focal point of nursing in ministry is almost absent across the country. The councils and associations of nursing, the national councils and the professional associations, there are huge leadership gaps indicated in that. And indigenous sector expertise, nurses as nursing experts, is something we yet have to develop. And deficiency of mentoring and supervision is a major kind of problem there. If we look at the regulation, Indian Nursing Council Act is there, and 22 states are having state level acts, and contents they are mostly, content and language, sometimes the articulation is different. There is no direct control of the national council over the state council. So these are largely within the federal system, that independence is something. So without having that definition, there are issues about that. Then in the nursing council, the dominance is there from the medical council and the IMA kind of organizations. That is one interesting observation. Then registration, live registration of nurses is not happening, and private sector is largely unregulated. If we look at the education scenario and development of nursing, what is kind of, practical training experience that people get from the nursing institutions when they get posted, the scenario changes. Sometimes they go to a good institution, then they are getting into a worst institutional kind of atmosphere. Sometimes they are trained in worst institutions and getting into good institutional frameworks. Then knowledge base, there is a huge gap indicated in nurses' involvement as part of their study in research and academic work. Council norms, most of the educational institutions are not adhering to the council norms, and faculty is a scarce kind of feature in most of the institutions, and opportunities for career progression and higher education for nursing professionals is few, less. And if you look at the deployment and utilization, there is no scheme of, although there is for the ANMs and all, there is a in-service training pattern adopted by the government, but posting of them is not happening in time. So filling of several posts are, before NRHM the scene was really pathetic. I think almost 10 years the posting scenario of nurses was very poor. And the senior cadres were having, the supervisory cadres were having more problems. And constraints related to inadequate emoluments are, the salaries and issues are there. Career pathways are not defined. Technical supervision, because of, the training institutions for the LHVs were not there, the supervisors were not appointed, then in essence there is no supervision. Then the government and private both are facilitating migration in a major way. So though we produce people, it is not water everywhere, not a single drop to drink kind of a situation is there. And the domestic private sector, lot of exploitation, sexual harassment, and deployment without formal training is a major feature. If we look at different settings or even settings, most of the nurse and nursing professional associations and councils playing least role in developing the policy sphere for the sector, and nursing research is not prioritized amongst organizations. That is another which I was highlighting earlier. There are a lot of ethical kind of challenges faced, like clash of values, what is taught and what is done. Bondage of labor, people are given to after the training or education loans and all. It's like something like they have to complete certain years or something, then people are facing problems. Employment without degrees, already I've kind of discussed it. Operationally, we have institutions without teaching staff. Environment, working environment and learning environment that is not matching properly. Technical mentoring and supervision is kind of an absent mechanism. Then compensations are differing. If you look at the political domain, medical fraternity is dominating, and overlapping reigns of control between the state and national councils. Nurses rarely positioned at the higher administrative levels as deputy director or joint director. Even many of the states are abolishing the cadre called the district public health nurse. And vested interests and power influence of the private healthcare lobby is something to be looked at. Structurally, there are gaps in policies, inadequate opportunities and involvement for policy spaces. Leadership development and managerial capacities is a major challenge, and contractual recruitments as a short-term solution creating a lot of issues. Then we have some recommendations largely related to which all areas to be studied, because this is a literature review. We yet have to come up with our actual study, wherein we will be having policy recommendations. Now we are looking at which all areas to be studied. So one, how to improve the quality of nursing education, what are the strategies that needs to be studied. Then institutional and leadership development strategies to be further explored. need to identify how to bring research onto the nursing mainstream. And nursing leadership and regulation, we need to yet identify strategies and system structures, processes for effective support and utilization of utilization regulation of the profession and services both. In terms of deployment, we have to yet understand further the paradoxical situation of huge gaps in intake despite the HRH crisis in the sector. Then we have to understand the barriers in achieving the equitable workforce norm for nurses. What makes it kind of inequitable? And we have to yet identify the gaps in in-service capacity development. There are a lot of institutions envisaged, but they are not functioning. And finally, about policy and planning, we have to understand contents of existing policies for nursing governance, what is their status, what is the extent of their implementation, and how an effective policy roadmap could be suggested for nursing development in India. Thank you so much.
Thank you, Raman. We'll take 2 questions. Yes, Vanna?
Thank you for this very interesting study. Even if it's the only one, it's very important because after all, without improved nursing and also something you didn't mention, midwifery, it would be very hard for India to bridge its historic gaps in maternal health and in what I call sexual and reproductive health. One question just out of curiosity, were there any nurses or midwives involved in the design or conduct of this study?
Of the study, yes. Kaveri, would you like to answer that? Or would you like to stand up, being the nurse involved? She's actually...
Is involved in the study, yes.
The other good news I'd like to share with Werner and with Raman and others is that the nurses have their own research association, a national research association which meets. The nurses have their own society now for community health nursing. I think it's a reflection of the gender issue and the patriarchy in our Indian system that we are not aware of the fact that there is a lot of very interesting work going on in the nursing sector. But there are reasons, all the reasons that Raman has said ensure that this doesn't come into policy. Personally, I know a lot of these groups, work with them. Sochni, as the group is called, is with us in our own center. But it is really, I think there's a gender issue which is preventing the work that is going on in the country. When you talk about nursing education, experiments in nursing practitioners, the fact that we as health systems researchers are not aware of it is a sort of a much larger issue which we need to also look at. But anyway, any other question? Yes, Bart.
Is it not useful to make the distinction between nurses and nurse practitioners?
Yeah.
Because they do different things. Nurses, if I understood your study, are responsible for nursing. Nurse practitioners offer routine, curative, preventive care, and in many instances, in many systems, constitute the backbone of your health system. So both are called nurses, that do very different things.
Yeah,
you understand my question?
Yes, I think so. We can answer that. We'll come to the last presentation and then take all the questions together. Abrar.